So we are going to go over what the reports look like when you get them from the radiation detection company. That's who we use. And this basically is just a list of all the employees who have radiation badges and who are being monitored for their exposure. And what it is looking for is the amount of millirems that you're exposed to in a year, because we do ours quarterly. It is an accumulative lifetime of what your dose is, and it tells you if it's deep, if it's shallow, and what your lifetime dose is for your exposure. And you can see right here, that's mine, because I do all the pretty much all the x-rays around here. So my shallow lifetime dose is 212, and my deep is 212 as well. So I'm actually still pretty low considering the number of years I have been doing this. And these live in a special binder when we get them in. And then we have our other binder that lives in the same location that has our radiation safety guidelines along here with it. And basically all it's talking about is making sure that you have your badge and that is worn in the proper place. And you can see on there, it tells you when it's going to be worn to and when it will be calculated. That's what it's going to be calculated as from the 24th of May to the 23rd of August. So we'll get a new report a couple weeks after, and we'll get our numbers then. As I stated in a previous shot, the badge that we have is to be worn on the thyroid shield at thyroid level. That's just our badges. Previously we had them to be worn down at the waistline because it was a different type of film inside the badge that records the exposure. So just a general thing again with safety, we have our gowns that are free of any cracks because we have them on a stand. You get some barium and whatnot on them once in a while, but they are free of cracks. I actually went through and x-rayed them for our last inspection that we had, and everything was fine. Same thing with our thyroid shields and our gloves. Everything should remain up on here so that way they don't crack. Because if there's a crack in the lead, then that means radiation exposure could potentially get to yourself, which is something you don't want. And we also have up on our board our notice to employees as per the state, as well as all of our regulations and guidelines, warning pregnant women not to be in here because they can have birth defects or even miscarry if they are pregnant and try to take x-rays and are exposed. They're at risk of terminating the pregnancy due to the radiation. Same thing with underage employees. That's why they have to be 18 or older, so that way you're not at risk of any developmental issues as far as growth or even just brain development in general. So that's why they're not allowed to be in here, which is also why we want to take our exposure the first time and not have to repeat anything. The fewer x-rays everybody's exposed to, the better off everybody is, not just the technicians holding, but also the patient who's directly under the x-ray beam. So that's why we try to utilize our chart system as best we can to make sure we have the right exposure and everything else to go along with it, so we don't have to do everything a million times, as well as our super long cord on our pedal. So if we have a sedated patient, we can take the pedal outside of the room and expose the image at that time to be away from the radiation as much as possible. So we're going to do a little mini tour of our radiology room. So this is our table, the head there, and then we also have our rotor unit that has our KVPs, our MAs, our MAs and our time. And then this is our on-off switch here. So when it turns on, the little needle bounces, turn it off, it goes back down, so that you know it's been turned off. We have tape that we keep in case we need to do any exotics, because we do see quite a bit of exotics in our hospital. We have all of our V trays, our bird restraint units, our sandbags, our gloves, thyroid shields, gowns, obviously. And then even here, we have an ET tube that doesn't get used very often. So it's one of the sizes that rarely gets used. So we keep it in here so we can use the tip of this to help push like a toe or keep an angle on a foot that maybe, you know, we're trying to do a quick shot on a patient that's not sedated. This is a really good tool to get those toes spread open, to get that done. And then obviously all of our markers, our left, our right. Our x-ray badges live just outside the door because they're not supposed to be in the room. And then our barium, if we ever need to do a barium series on anybody. So that's just the quick room. And then our computer system that we have here. We don't have our software linked to our x-ray unit, but we can create JPEGs later on and attach them into the file so that they're there, but it's a completely different step. But to go into here, to make a new submission for x-rays, you just add here, you're gonna add the patient's name and all of their information into this system here. And then what that looks like once that's done, we'll go into one that's already been done. We'll go into it and it'll open up this shot. So once you put in the patient's information, it'll come to this screen and it'll ask you what part of the body you want to work with. So it'll be one of these things here. Then it'll show up here, and then you hit the next arrow over. And then you're going to take your shots. So if it's not one that you want, or if it's one that you're, you know, just doing for professional interest and you're not charging the owner, this is how we've done that. So you would add additional shots here, go and get another shot if you missed it, and then just push the next arrow to clear out of that screen. Okay, so to request or to put in a new entry for a patient, we come to our plus sign, then we're going to enter our patient's name. And then he is roughly 50 pounds, and he's what, 3 years old, 4 years old? Yeah. I'd say he's 4, I think. And he is a lab type dog mix. He's a neutered male, and put in the last name here, because if you don't put it in 2 spots, it makes it harder to find it in the search. So we are going to be doing his OFA pelvic shock today. So we're going to go pelvis, and then we're going to be doing our VD, and we'll go through the process on that. And then for the study, we can just put in here OFA hips, and then your next screenshot. So now you're ready to take your x-rays. We don't have calipers because we're completely digital. So this is our chart that came with our unit. So we're going pelvis, and then we find our body weight to match up with it. So 46 to 80, he's roughly 50 pounds. So we come over here. So our KVP is going to be 84. Our time is going to be 1/30th, and our MAs are going to be 300. So pretty much everything is 300 MAs, so we don't ever really have to change it. So that makes it pretty easy. Same thing with the timing. It's usually 1/30 or 1/60. So to set it up, we turn on our machine. This is already set. It doesn't usually get touched. Set our time is already at 1/30. And then our KVP, what was it? 80. 80. Double check. Pelvis, 84. So we have our major and our minor adjusting. The major goes by tens and the minor goes by 1. So we're gonna go halfway, just before we get to the halfway, for 84. And then I always turn it back off until we're gowned and completely ready to take our shot, so that way you don't step on the pedal. We all have our X-ray badges, which measures the amount of scatter radiation we're exposed to. Our table and our tube is already set to the right height that we need. And we even have it on here when we do birds and other exotics. If we're gonna do tabletop for the old cassettes, it's not so much an issue anymore because we're completely digital. But if we need better detail, we can still adjust our head up and down. And so, here, that one's yours. Going to get our gowns on. And this is going to protect the majority of our body from any scatter. And then our thyroid shields to protect our thyroids. And that's where we're going to wear our badge, because our monitoring system, it requires you to wear it on your thyroid shield. Others require it down here or in front. It just depends on what monitoring system you're using. And I always mark on the right side. We have our V trays, which have Velcro restraints on them. If you have a super good dog, that will let you do that if they're not sedated. We also have our sandbags for restraint, and we also use tape from time to time when need be. And then we have our gloves before we get started. All right, turn it off and then you can get down. All right, so we're going to do our CR, CD, radius, ulna. We've already got our machine set, and our patient is sternal, and we're going to attempt to get both of his feet in here just like this. So you want to have your head forward, and you want to try and have these as symmetrical as possible, but he's not going to allow that. So we're going to just collimate. Stay, Bubba. Good boy. Stay right there. And then we're going to mark our left foot, like so. We have our positioning that we want, so you want to make sure you have your gloves on. Good boy. Good boy. Stay. And then we're going to expose. And that's it. Okay. So we're going to be doing our VD thorax. So we have our patient on his back in our V tray with a sandbag to help keep him in position. So you have your positioning tray and your sandbag for positioning purposes. You want the legs pulled forward away from the chest. You want the X-ray beam right in the middle. And then you're going to take the shot. And that's it. You got it, you got it. Okay, so we're going to do our OFA hips on our volunteer for the day. So now that we're pretty much in position, we want to turn it on. We already have everything set. We've got our pedal within reaching distance. That gets the rotor going, so it doesn't take quite so much time. So the patient gets used to it. You want to get him into the beam. Come on, relax, you're okay. Come on, Ranger. And then we're going to set our culmination, put our marker. And what you want to do is you want to try to frog leg them first, rotate them in, and bring them down and together. And what that's going to do is going to give you perfect positioning. Hit the pedal. Once you hear the beep, then you're done, and you can release your patient. All right, start off. Okay, so we are completely digital, so we don't have logs because we have our chart here, and we don't have calipers because we have our chart here that tells us the weight and what to set our machine to. So in order to have any kind of log like this, what we can do is we can go back into our system and search our patient that we used for this. Open it back up here, and then we're going to do the little play button to review his images. So there's his OFA hips that we did, his thorax, his abdomen, and the CRCD of his radius and ulna. So we know the shots that we took. We know his body weight, that he's roughly 50 pounds. So all we would have to do is go back to, say, extremity here, the weight range 46 to 80, and then his KVP is going to be 52, the time is going to be 1/30, and then the MAs are going to be 300. And so basically for your sheet, what you're going to do is you're just going to fill all that information in here. So our KVP was 52, MAs are 300, and 1/30. And then no measurement, and this was a CRCD, front limbs. And this is why we don't have these records, because they're so tiny and it requires too much information that you can't actually read it later on. He's a canine, and his ID was 1, 2, 3, 5, 6, and the date was, I think, 6/20 or something around that. And so you would just fill this out. For this part, if you keep reject, I think that would be more for film type radiographs, where if you know you had to retake it or not, and this is an indicator whether those settings worked. So you can put here good, and then you would just go each patient there underneath that for each one. Or if we had our same patient here, we could just go down, fill in another line. We did thorax, we did VD, and then our measurement for that was 90 for our KVP. It was still 300, and then we had 1/60. So that would be how you would do your order for the same patient, and then your next one you would obviously come and do another date, so 6/22, and then enter in their information accordingly. Okay, so this is our computer system, and we run off of Avimark. So the way that we have our thing set up here is he's checked in here. So what we're going to do to add a new entry to know that we're taking radiographs is we're just going to write in the description, and it will come up interpretation and study. This is what we do here, and then that's how that'll come up on the line item, and it'll have the charge here, and then it'll show the date that it was done. The time is more or less irrelevant because the doctor could request the images at 8 o'clock in the morning, but we don't get to them until 2 o'clock in the afternoon, and that's so we're going to use one of our JPEG images as if we had an ultrasound image. So we would basically scan it into the computer, turn it into a JPEG, and it would look like this. So we'd save it to the top of our desktop so it's easier to find, and then we have our patient open here. So say this was an ultrasound, and then we're going to come over here to the attachments on the side, and we're going to hit the attachments button, and then the little green icon to add a new attachment. And then we're going to go from the desktop, and we're going to find it there. And then we're going to open that, and then we hit OK. We have to go and save it into the server before it'll actually save onto there, but this would be the process. So then you would hit OK, and it would pull up this same screen again, and you could add another one and another one and another one. And that's a similar thing that we do for patients when they come from another hospital. We have this little indicator here that says previous vet records. So we would attach any previous vet records such as vaccines, patient history, any other diagnostics they may have had done, blood work or ultrasounds. Those would all have a separate line item that says, you know, previous records, and then it would be over here, and once it's attached, it actually turns red, and then you can click on it and it opens it back up, and it'll show here. and you can view it that way if it decides to open. So then everything's in there, got scanned in as a PDF. So here's the blood results, recent heart rhythm test, physical, and everything else that's in here. Done. Our volunteer is going to be getting some barium because, you know, he's a lab type, so maybe he ate something. A dog this size would normally get around 100 cc's or so, but he's gonna have just a little snack today. So the easiest way to give it is in the little cheek pouch right here. He's already licking just from opening it. So you can just put it right in here as they drink it down and make a big giant mess everywhere. Just give a little at a time. Good boy. Like you've done. Okay, so he's had his barium. It's been about 10 minutes. So we're gonna take our first shot to see where it's at. And then if we see anything of suspect, then we'll continue to take the same shot roughly every 10 minutes until we've reached a conclusion to whether he has an obstruction or not. So we get our initial, we have our marker, and our good boy.
Stephen Chrome. I'm the veterinarian at Santa Rosa Veterinary Hospital, and I'm evaluating Abby Moreno for her radiology skills. Abby has been taking radiographs for me prior to our electronic system. We had a processor and she did excellent with that. Much better now that we have radiology as electronic systems. We do have dental x-ray capability too, and Abby Moreno has been excellent at doing x-rays for us, both thoracic, abdominal, limbs, and dental.